Good evening, Dr. Ray.
Good evening, everybody.
Good evening, Mr. Vice Chair. Good to see you.
You as well. Let's just keep our fingers crossed for power and internet throughout this discussion.
Absolutely.
Yeah.
And it's 5 o'clock, and by my count, it is 5 p.m. and by my count, we do have quorum. So I will call this August meeting of the Durham County Board of Health to order. Hopefully everyone has had a pleasant summer and enjoyed your month off from the board meetings. But we have our work before us today. The agenda and the minutes were sent out. Hopefully everyone has had an opportunity to review the agenda. I will entertain a motion at this time to amend or accept the agenda.
So moved to accept the agenda.
Second.
All right, it has been moved and properly seconded. Do we have any debate? All right, we are ready for the question. Ms. Patterson.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Miller, Commissioner Alum, Dr. Glover, Dr. Otto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
Dr. LaRae Jackson, Dr. LaRon Jackson, I'm sorry.
Yes.
Thank you.
All right, very good. So again, hopefully everyone has had an opportunity to review the minutes that were sent out. Making that assumption, I'll entertain a motion to accept the minutes.
Motion to accept.
Second.
All right, it's been moved and properly seconded. If there's no unreadiness, we are ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Miller, Commissioner Alum, Dr. Glover, Dr. Otto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
Dr. LaRon Jackson.
Yes.
Thank you.
All right. So the next item on our agenda is for public comments. Deputy Director Patterson, have you been made aware of any public comments for this evening?
No, sir.
All right, very good. So we'll move on and give Dr. Jenkins the floor for staff and program recognitions.
Thank you so much, Mr. Chair, and to this illustrious group, we welcome you back to the great work of public health governance. While I don't see her on the screen or anything, I definitely want to give kudos and highlights to our lab team. They were able to have another successful CLIA inspection, which took place on June 25th, 2024. And safe to say they passed with flying colors. They were able to, out of a 2-day proposed visit, they were able to knock everything out in 1 day. And I'm proud to tell this group that while there were some recommendations, they did pass with 0 deficiencies. So that just really speaks to the leadership of Josie Paul and the rest of our expert lab personnel being able to accomplish this yet again. I did quip with them that you guys are getting really good at this, but that's exactly what we want. Although Josie is not here, inside the health director's report is a little bit more detail about the CLIA inspection and all the good work that they did. Other than that, Mr. Chair, that's all I have.
Awesome. Awesome. Thank you. All right. Well, we'll move right into our administrative reports and presentations. We have our fiscal year of 23-24 fourth quarter fiscal overview. And Micah Gwendon will give you the floor at this time.
Thank you. Okay, can you all hear me?
We can, yes.
Awesome. Great. Well, I'm happy to be with you all. I do have a brief report this evening. I want to discuss our end of quarter four. Oh my goodness. I'm sorry, I have the wrong presentation here. Give me 1 second, please. I am happy to be in quarter four. Okay. Here we go. That's the one we want. Okay. So once again, good evening. Happy to share quarter four fiscal update with you all as we close out our fiscal year 23-24. The Department of Public Health is ending fiscal year 23-24 with a revised budget of $31,668,056. In quarter four, we had budget amendments that were related to the opioid funds, the DIME program, and some federal pass-through funds from ARPA, or the American Rescue Plan Act. Our expense budget, including benefits, was at $56.11 million at year's end. And at the year's end, DPH spent $33,940,466, or 86% of our general fund expense budget. Salary, miscellaneous contracts, fringe benefits, including FICA, supplemental retirement, and retirement, are, in addition to immunizations, are some of the general ledger line items that were at the top of our spending list at the year's end. The trend with salary and fringe remains the same, as of course that's our greatest expense. And we did do an end of year push with immunizations with some of the remaining funds that we had in various areas. So we made sure we had enough immunizations on hand to start this fiscal year, the current fiscal year 24-25, ready to go. In terms of revenue, the Department of Public Health has brought in $10,480,440 in revenue this year, which makes up 73% of our revenue budget. Since revenue can have a delay for a couple of months, we do expect this number to continue to increase a bit as we're still receiving revenue from fiscal year 24 and posting that in our systems through mid-August. Medicaid ends the year as the highest revenue source for the department at the year-to-date total of $5,160,614. Grant revenues total $4,415,624. Those two revenue sources make up 92% of our department's overall revenue, 91. And our service fees total $582,942 to date. I do want to highlight to you all some revenue collected from our state grants or AAs, as we call them, for fiscal year 24. We were awarded 31 state grants that are for 1 year only for fiscal year 24, meaning that if those funds, they would be reverted if they weren't pulled down in the current year. So further, those are reimbursement grants. So if we don't spend the money, we don't receive the money. So of those 31 grants, which totaled 3.9 million, we collected 3.5 million in revenue, or 90% of the awards given. Last year, that percentage was at 70%. So we're quite proud of that improvement. That's all I have this evening. So I'm happy to take any questions that you all may have.
I think I saw Mr. Gregorio's hand up.
Yes.
Yep.
Thank you.
Recognized.
Thank you, Finance Director, Ms. Gwendon. A great presentation, as always. Just 2 questions on my end. For that last slide with the 31 amendments, I did see that there were, at least in the director's report, that jail testing and integrated targeted testing services to an amount of 460,000 or so was included. Is that also included in 31 in this amount for the grants?
The jail testing agreement addendum is included in the 31. Yeah,
Okay.
I'm not sure specifically what the report was in the director's report.
Sure.
That may be on current year numbers.
Okay. Yeah, I'm just curious. It looks like it was the revenue for FY 23 and 24 for this current fiscal year. So just wanted to make sure. And for the DINE program, I did see that there were we were expecting operational decrease in budget. I assume that was also baked into the earlier slide where you mentioned DINE. Okay.
Yeah, we had an amendment this year for the DINE program. The DINE program operates on a federal fiscal year.
Okay.
So we actually, in Q4, I believe that's when we finally got the contract for, because the contracts with the federal fiscal years tend to be very delayed. So we made that amendment, and then they did receive notice recently that they have an overall decrease for their current year. So the budget tends to shift a little bit retroactively, a little bit slower than the actual news. That makes
Gotcha.
sense.
Okay. No, absolutely. Thank you so much. And yeah, I like the analytics with the new dashboards. The sales per auto is really cool. So thank you.
Yay, good. But I will let our population health team know, because JP and I are always tweaking that. So thanks, and appreciate your questions and comments as always.
Thank you.
All right. Any other comments or questions? Once again, thank you, Ms. Gwendon. Great work. We appreciate all that you've done in preparation and the presentation that you made for us today. Thank you.
Glad we got on the right one.
Yeah, absolutely. All right. So we're going to move to the next agenda item, which is our presentation on the community health assessment by Ms. Bria Miller. Ms. Miller, you have the floor.
Sorry. Good evening, and thank you. Are you able to see my screen?
Yes, ma'am.
All right. So as stated, my name is Bria Miller. I'm the Partnership for Healthy Durham coordinator, which is a part of the Population Health Division led by Marissa Mortaboy. It is a pleasure to be before you all, Board of Health, Dr. Jenkins, Deputy Directors, Kristen Patterson and Liz Stevens, and everyone else who is here in attendance. I'm going to give a brief overview of the 2023 Durham County Community Health Assessment. The Community Health Assessment provides a comprehensive set of valid and reliable information about the health of the Durham community. We, Durham County Department of Public Health, collaboratively produced this Community Health Assessment along with Partnership for for Healthy Durham, and Duke Health. Local health departments are required to complete community health assessments every 4 years for accreditation purposes. Because we do this along with Duke Health, we run on their cycle. And because of the American Care Act, they are required to complete a health assessment every 3 years. So we operate on that schedule. We strive to make it easy for members of the Durham community to access and understand the information. And we partner with organizations to get buy-in from the very beginning of this process. Our process is a little unique compared to other communities. The health system, health department, and organizations collaborate throughout this process. And the community requests this document and uses it for grants, presentations, advocacy, and more. Here's our vision statement. The community health assessment is rooted in the community and uses high-quality, reliable data to provide a clear and detailed picture of the health, assets, and needs of Durham County residents in order to equitably guide decision-making, programs, and policies to improve health outcomes. So, for our countywide survey sample, we do it a little uniquely as well. We still do the door-to-door, and we're one of the few counties to still do this in the state. This offers us the opportunity to reach community members who are often left out of surveys that are administered online. Several of our volunteers reported that community members thank them for allowing them to be a part of this process. I actually had the pleasure of connecting with someone who had been formerly involved with our legal justice system and said that he really appreciated being asked about this because he's rarely asked for his opinion. For our Comunidad Latina survey sample, we hired Spanish-speaking contractors from the Durham community to administer surveys at community events, and we call this a convenience sample. After we collected the data, we analyzed it, we mainly being the epidemiologists and data scientists. Then the writing process began, which is also unique. We collaborate with subject matter experts throughout Durham to write our community health assessment. Many of those folks are from Durham County Department of Public Health, but lots of community partners are also involved in this writing process. We submitted the report to the state in March of 2024, and it was open for 1 month for public comment. The final version is now available online. We conducted listening sessions May through June in English and Spanish for a total of 14 sessions, and I'll go into more detail about that a bit later. We are almost finished now drafting our community health improvement plans, and as everything else in our process, this is also collaborative, and we will submit this to the state by September the 2nd. This is an award-winning process. So pictured here is Marissa Mortaboy on the left and I'm on the right. We won awards for excellence in 2017 as well as 2020, and we are expecting another award for this year's community health assessment. So here are some general highlights. We had 53 community volunteers to participate in the survey administration. 86 writers from our community contributed to this document. We collected a total of 205 countywide surveys and 176 surveys for Comunidad Latina. And the document has 15 chapters, 41 sections, and 427 pages. So some key findings. Racial and ethnic disparities exist across nearly all health outcomes. Structural racism and historical policies such as redlining, immigration laws, and segregation are causes of health disparities. We also know that issues are linked. For example, housing issues are also access to care and food insecurity issues. Most participants reported that their neighbors made their community a good place to live, followed by the neighborhood being quiet and safe. This time around, we added 2 new chapters, one on COVID-19 and another on environmental justice. Of course, we had to do one on COVID-19. We had to highlight the incredible work that was done in our community here in Durham to respond to this pandemic. And we were also able to capture some information about people's lived experiences and also their resilience. We are one of the first counties in the state of North Carolina to include environmental justice as a chapter in our community health assessment, with Alamance County being the first. and we did speak with them a lot, and they were able to advise us in the process. We had a more comprehensive focus on Durham's history in this edition. It's actually longer than the other sections of the community health assessment, and that was important so that we could understand why our health status is the way it is now. Our data scientist, John Paul Zitta, built a community health assessment data dashboard, which allows users to interact with the data we've collected for over a decade. And as always, we have an ongoing commitment to equity. On to the top health priorities. So this time we used a different process to determine what the health priorities are in our community. Instead of using a survey, the epidemiologist Savannah Carrico and data scientists already mentioned analyzed the information from the community health assessment, healthy communities, and census tracts, as well as listening sessions. We conducted listening sessions both in English and Spanish, and we specifically reached persons with disabilities. The top health priorities are affordable housing, access to healthcare and health insurance, violent crime, mental health, and physical activity, nutrition, and food access. The new health priority this time is number 3, violent crime. The Partnership for a Healthy Durham and its steering committee has had several conversations about this particular topic and have chosen to proceed by calling it community safety and well-being, which allows us to look at this issue through the lens of public health and also to support existing efforts that intersect with other community health issues. Now on to some data. So as I present this information, it's really important to note that we cannot compare the findings that we have from the county-wide survey sample and the Comunidad Latina survey sample because we use 2 different methods. This is considered representative of Durham's population. So beginning with numbers from the number 1 health priority, affordable housing. In the county-wide sample, we asked what is easily accessible in your neighborhood. We wanted to make sure to ask an assets-based question, and most participants said that grocery stores, pharmacies, restaurants, parks, and bus stops are easy to access in their neighborhood. The most common reason for people having difficulty finding housing was affordability, followed by the commute being too far. Of participants who own their home, whites were 3 times more likely to own their home than Black or African Americans. This gap has widened since the 2019 survey, in which whites were only 1.68 times more likely to own their home. Now looking at access to care. From the Comunidad Latina sample, 41.9% of respondents reported having health insurance over the past 12 months, while 58.1% did not have health insurance at some point over that past year. The number 1 reason for not having coverage was immigration status. For community safety and well-being in the county-wide sample, 18% of participants named violent crime, 4.7% theft, and 4.2% gang activity when asked what has the greatest impact on quality of life. Neighborhood violence was a primary cause of stress for 12.2% of respondents. Now for mental health in the county-wide survey. 40% of participants reported their mental health worsened since March of 2020. 41.5% said there was not a change, while 12.4% said their mental health improved. Financial stress was the most common reason for stress, followed by work at 30% and personal relationships. Many people listed other reasons for stress, including political environment and the social well-being of society. Now for the 5th health priority, physical activity, nutrition, and food access. From the county-wide sample, 83% of respondents reported they never worried that food would run out before they got more money to buy more in the past 12 months. Most participants reported that walking is their primary form of exercise, followed by lifting weights and gardening. These are the same top 3 forms of exercise as we found in 2019. The most common reason for not eating healthily all of the time was that people didn't have enough time, followed by cost. My time here today is limited, but there is a lot of very good information. So I wanted to again highlight our data dashboard with that trend data, which covers information for over a decade. There are two separate dashboards. One is in English, and you can find that in for the county-wide survey. And then the other one is for the Comunidad Latina sample, and that information is available both in English and Spanish. You can get this information from the Health Data Resource page of healthydurham.org. So I wanted to highlight a couple of things from the town halls and the listening sessions that we held. The pictures that you will see on this slide, as well as the next slide, are from the actual conversations that we had in the community. We hosted several of the sessions at local, BIPOC, Black, Indigenous, and people of color owned organizations, as well as places of worship throughout the community. And El Centro Hispano hosted the sessions in Spanish language. We had facilitators and note takers who were from Durham County Department of Public Health and other folks who are affiliated with Partnership for Healthy Durham. People reported that they felt safe and comfortable speaking to us. And they could tell that we really wanted to hear from the community. So on this slide, there are some quotes that really stood out to me and are very powerful. So please take some time to read those. Here are a few things that we learned. We learned that safe environments would encourage people to be more physically active. They have concerns about crime, lack of traffic control, and they would really like to have safe and accessible sidewalks. Some improvements that they mentioned were needed in homes were things with electrical issues and also a lack of landlord responses whenever they would file complaints. Also, several people mentioned fear of retaliation, and that is a reason being for why they would not place a complaint or voice a complaint that they had related to their housing. People also highlighted the inability to access care and that unemployment worsens their mental health. Partnership committees are using the data from the listening sessions and town halls in our community health improvement plans process. So participants are reviewing quotes like the ones that you see here on this slide, also summaries, and other general information from those to build the information for our community health improvement plans to make sure that they are reflective of what the community said is needed. These will be submitted to the state by the first Monday in September. So next steps, we are already in the process of planning for the 2026 Community Health Assessment. This time we are adding a Black or African American sample because our community has been requesting it. This time, of course, we learned a lot, and going door to door is great, but it is limiting. So we are going to do a mixed method this time. In addition to doing door to door, we are also going to go out to places where people are already convening in our community. The survey will be finalized in the fall of this year, and we will incorporate feedback from partners and community members. Thank you so much for taking the time to listen to my presentation. We have the community health assessment available, as well as the executive summary, which I believe you all have a copy of, both in English and Spanish, and the data dashboards. I want to thank everyone who's contributed to this community health assessment process, because it truly does take a lot of folks coming together to complete the process the way that we do. Do you all have any questions?
I wanted to make a comment more than a question, just to thank you for a wonderful and very informative presentation. Just tons and tons of information. I do plan to go back and look at the dashboard. But on one of the last slides that you had there with the quotes, the one quote that I couldn't quite make sense of was that charity is killing people. What can you give us a little insight to what that meant?
That was very powerful. So in this particular conversation, the person was expressing how they have high blood pressure and type 2 diabetes. And a lot of times whenever they go to sites to receive foods, they are canned foods that are very high in sodium, or they're packaged goods that are high in sugar and carbohydrates. And they expressed that, like, while they are grateful to receive food that they wouldn't have to pay for and it wouldn't have to take away from resources that they could put towards something else, those foods are often detrimental to their health, and they would like to have better options that would support their well-being.
Awesome. Thank you. Yeah, I would have not come to that conclusion. So thank you for clarifying.
You're very
Do we have
welcome.
any, Mr. Gregorio has a question. We'll recognize you, sir.
Thank you. Ms. Miller, a wonderful presentation. In terms of the distribution of responses, was it standardized across the county, or was it more localized in certain areas of Durham City? Only curious because I happen to be a downtown resident, and I kind of laugh at grocery stores being a little accessible, at least in my area. It's definitely not walkable, and I do wish, with all the food deserts that I'm sure many cities have, I wish we had more grocery options in downtown. So I'm just curious to know how the data was set up.
That's a really good question. And we get this often because a lot of this is dependent on people and where they live and, what resources are available to them more locally. But with the way this is written out, it's mapped with all of Durham County in mind. And then there's a random selection of neighborhoods within the different census tracts.
Thank you.
You're welcome.
Dr. Jackson, I see your hand up.
Thank you, sir. And thank you, Bria, for that presentation. Just the information and the data speaks volumes. One of the questions that I would like to pose is regarding how do we evaluate this data? What's our measurement? What's our benchmark? Are we comparing it in the sense that we want to continually improve from the previous county health assessment? Or is it something that we are trying to aspire to achieve to be on par with other cities and communities that have similar structure and demographics and such?
That is an excellent question and something that I think about very often. And I would say both. So first, we are looking at ourselves as a community in Durham, and that's why that trend data dashboard is so important, because ultimately we want to make sure that we are improving in all of these areas. So every time that we do this community health assessment, it does also help, though, for us to look at surrounding counties so that we can compare other folks' outcomes. And if it is that someone had a significant improvement, it may mean that we are connecting with people from other counties to figure out what they did and whether or not their interventions are something that we could easily adopt here in Durham.
Thank you.
All right, I'm looking. I don't see any other hands up. So we'll say once again, thank you, Ms. Miller, for an awesome presentation. And we know that Dr. Jenkins and his staff are working diligently to address all the issues that were highlighted in your in the assessment. So, all right, so we'll move on with the next agenda item. We have our vacancy report, public health vacancy report for June and for July of this year. So we'll give Dr. Jenkins the floor to.
Thank you, Mr. Chair, and it definitely allows me to present some good news. As I have been saying for so many months, we were right on the cusp of seeing a precipitous drop in our vacancy rate, and that has finally arrived. We really had a lot of vacancies in our school health program. Just this past Tuesday, we had our school health nurse kickoff to start the school year, and it was just delightful to see so many new faces. The conference room was packed, and that's indicative of just really giving shout outs to Director of Nursing, Kiki Rayner, and also our newest program manager for school health, Sarah Snyder, and many of the team leads who have been interviewing like crazy. So with that being said, with the majority of those positions being filled, I think my tally may be a little off, but I think we are only having probably about 6, maybe 7 positions out of 40 to 50 that have been filled. that has really helped drive home and drive down the vacancy rate. So proud to say that right now, a vacancy rate is sitting at right at about 13.5%, and that has been the lowest it's been since the pandemic, really, to be honest. So we're proud of that work. We're not done. We know that Durham Public Health is the employer of choice, and we're starting to see a lot more nurses choose us, and we're grateful for it. Mr. Chair.
All right, thank you so much. We'll next move to our public health NOV report. I didn't see Mr. Salter on the call, but he might be there. Okay, very good. There he is. So it was a little hard to read the reports listed because I
noticed the format was kind of off this time. Apologies for that, but
no problem.
There's really no real significant change. I think last time we met, I did touch on the fact that we have like 7 or 8 of these NOVs that are approved for connection to municipal sewer, which is always the best solution to this problem. Unfortunately, it's still a slow process, and I don't believe we had any since the last time I talked to Patrick that did get connected, but we've got a few that are getting close. So that's always a good thing. The most significant things other than that is that we continue to work with County Legal, Attorney Millott and McKinney, and we're discussing how to best address some of these older NOVs. The most significant one was 5904 Wilma Street. That was, I believe, our oldest one, which was issued in near the end of January 2023. So it's been hanging out there for like a year and a half. We did issue a repair permit for this property in the spring of 23. I believe it was April or March maybe. And everything looked like it was going very well. And then we got no communication after that. And we've reached out several times and we've got no feedback, just being ignored. And so we've actually visited the property. The NOV still exists. And so we reached out to Attorney Millott and asked for a 10-day demand letter, which she has issued. I believe it was kind of toward the end of January or the middle of January, I'm sorry. And we've gotten no response since then either.
Just to clarify, July.
July, I'm sorry. Yeah, I meant July, obviously. But unfortunately, sometimes we have to see legal action on these. We don't want to do that, but we can't let these persist. Just to put something in everybody's mind how this works, these NOVs don't always just impact the person whose property the NOV exists on. Numerous times, according to how landscape position exists, the effluent could be flowing down on a neighbor. And that's what I can't tolerate, when somebody has the means to fix something and it's impacting somebody next door. That's when we can't ignore it. It's never a good thing, but sometimes we just have to seek legal action. And fortunately, we're very pleased with our interactions with our current legal representation. It's been very, very, very refreshing to deal with our new legal representation and Attorney Millott and McKinney as well. It's going well, and we're looking forward to working with them more.
So I had a question. And Attorney Millott, you can jump in here as well. Once you issue that 10-day request to reply, if they don't reply in that 10-day window, what is the next step to seek resolution of the violation?
We actually have scheduled a meeting in our office to talk with interim county attorney Curtis Massey, and then we'll follow up once we meet internally. I think he's going to join our meeting with Mr. Salter and Mr. Eaton next week to talk about exactly how to proceed. The statute allows us to take legal action, to file a complaint in court, but I think we want to just talk through where we are and determine what the appropriate next steps are. And I will say that I'm really grateful for Mr. Salter and for the health department's willingness to help us explore how to get some of these documents interpreted into the Spanish language, and at the very least to include some kind of information for how people can seek a translation of the documents if it's not in their language, because certainly we have people who live in Durham who don't speak English or Spanish, and perhaps don't read English or Spanish. So just being able to do our best to communicate with people so that we can really say, if it requires court action, that we did everything we could first.
And just as a follow-up, and I appreciate the measures that you're taking, that will be taken to avoid sort of a last effort action. But what would that last resort be? Would that be eviction from the property? What sort of?
So the statute does allow, and Attorney McKinney, please feel free to jump in at any point, but the statute does allow an action to be filed in Superior Court, and those actions then are sent to mediation. So an attempt would be made, continued attempts to get a person to comply, but then a court can order an injunctive relief and order that they abandon the property, or that they take corrective action within a certain time period, and then can order, fees to be paid also.
Thank you. Let's see. I didn't see any other questions or hands up. Do we have any other questions or comments regarding our NOV report? Thank you once again, Mr. Salter, Attorney Malott, for your responses to the questions. And for your overview of the report. Yeah, thank you. All right, so we'll move on to our health director's report. We'll give way to Dr. Jenkins again to review that report with us or highlight.
Thank you so much, Chair McDougall. And it's always a tough task to highlight so much great work, but I'll be brief and just highlight two things. Definitely want to give credit where credit is due, and that's the expert leadership under Jim Harris in our dental unit. I want to bring the attention to replacing the x-ray equipment with Nomad units. I think it's innovative. It really speaks to collaborating and using these state grants that we have in order to produce good results. So we are in the process of getting some Nomad units to replace aging x-ray machines. And it's going to really make for better efficiency. But most importantly, it's going to allow us to use those state dollars, in which I'm pretty sure my leadership team is tired of hearing me say, don't leave any money on the table. So we can be creative and, kind of get those things in place. We certainly want to make sure that we do that. And we look forward to providing that service to our community. And then, of course, under the leadership of Deputy Director Kristen Patterson, we have selected an opioid settlement manager. And as I have mentioned to this great board, the opioid settlement funding is now housed in public health. And we are working collaboratively with every department throughout the enterprise. But we needed that one individual that could work internally and externally, and also work with Deputy Director Patterson in an effort to ensure that we are crossing our T's and dotting our I's, and making sure that we operate within NC Core, within county parameters, and most importantly, using those funds to make a difference in the community. Proud to announce that Mr. Jason Smith is our program manager, and he has been charged with a big job, which is to fulfill the goals that we have set for Durham County, but also to expand those goals within the community. So those are the two things I wanted to lift up to this board in the health director's report. And of course, willing and able to speak on anything else that this board would like to expound.
So I'm looking for hands. I don't see any hands up. So I will ask a question. You did touch on one of the things that I had a question about. That was the opioid settlement program manager. You identified a person, and I think you stated his name. is there a time frame that we can expect that he will be officially named to the? I know the
Yes, sir.
bureaucracy
Yes,
is
sir.
an issue.
Red
But,
tape has been sliced and diced.
Okay.
His first day was Monday, August the 5th.
Oh,
And
okay.
not only did he start on Monday, but he is already at a conference with our fellow county commissioners, learning more about what we need to do in order to use these funds and to make a difference. But his name is Jason Smith. He's no stranger to public health. He was the program manager for our Bull City Strong Health Literacy Initiative and has a ton of experience working in the city of Baltimore. So we lucked up and got someone whose talents can extend beyond health literacy onto the realm of opioids and community linkages of care and all of that stuff. He's quite experienced. So we look forward to greater returns.
Awesome, awesome. So congratulations to Mr. Smith. With the harm reduction specialist, from reading the report, it sounds like you made a recommendation. Certainly interviews have concluded. Do we have someone in mind for that position? And again,
Yes, sir. Yes, sir. We do have someone who has experience in another county, from my understanding. Not necessarily ready to go above board with that name just yet.
Sure.
Almost at the end of the red tape cycle, but we look forward to presenting that to the board at a future date.
Awesome. All right, very good. Looking again to see if we have any other questions or comments. I don't see any, so we will move on. We don't have any committee reports to go over today. No old business. For our new bit.
Mr. Chair, I will speak toward some old business, which was us really talking about the meeting frequency for the Board of Health.
Yes, sir.
As mentioned previously, the board was petitioned to think about the possibility of meeting every other month. The benefits of it is, of course, we know your time is very valuable. We appreciate your time. But we do know that meetings can get a little bit repetitive, and there's but so much that we can talk about. But at the same time, you guys are doing a great work here in Durham. In going every other month, we are fulfilling our statutory obligations. And then we also know that if we do get in a crunch, say for instance, budget time or whatever, we can do a call meeting. We can have that flexibility. But we certainly hope that the board, during your month off, had an opportunity to think about it. Mr. Chair?
Absolutely. So I'm wondering if it's appropriate at this time to entertain a motion to that effect. Is that appropriate? I mean, I know we want to
indeed
put
it
it
is
to a vote and maybe even revisit it at one more meeting, but if it is appropriate, I would certainly entertain a motion from a board member to move to a bi-monthly meeting.
Yeah, Dr. McDougall and Dr. Jenkins, I support and make a motion to move to bi-monthly meetings.
And Dr. Ray and Dr. Jenkins, you can help us out here too. Do we have a start time or proposed start time maybe in January that we start that, or immediately?
This can be immediately.
Okay. Is that your desire in your motion, Dr. Ray? Okay.
Yeah, absolutely. Unless there's some type of requirements of us making public notice or something like that, I think immediately makes sense.
Very good.
It's important to indicate that all of our meetings are publicly noticed, and so I think we're clear on that one.
Okay, very good. So we have a motion on the floor. I will entertain a second.
I'll make a second.
All right. I think I saw heard Dr. Miller on the second. So it has been moved and properly seconded. Do we have any unreadiness or debate on the issue? Seeing none, Deputy Patterson, we are ready for a vote.
Dr. McDougall?
Yes.
Dr. Ray?
Yes.
Dr. Rosemary Jackson? Dr. Miller, Commissioner,
Yes.
Commissioner Alon, Dr. Glover, Dr. Otto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
Dr. LaRon Jackson.
Yes.
Thank you.
All right, very good, very good. So new business, we have 4 budget amendments to consider. Dr. Jenkins, I'll let you review those with us.
Most appreciated, Mr. Chair. And again, the 4 for your consideration, the board is requested to approve Public Health's request to create 1.0 FTE community health worker position. This is a grant-funded position that requires no additional county funding, as it is coming from the state. Funding is for this position. The funding for this position is already budgeted within Public Health's fiscal year 2024-2025 budget. This position will support access to women's health services and improve the cultural competency or competence of service delivery. The second budget amendment, the board is requested to approve budget ordinance to recognize funds in the amount of $140,350 from the North Carolina Department of Health and Human Services Division of Public Health Epidemiology section of the Communicable Disease Branch. These funds will be used to support communicable disease surveillance, detection, control, and prevention activities to address COVID-19's public health emergency or other communicable disease challenges impacted by COVID-19. The third, the board is requested to approve budget ordinance amendment to recognize funds in the amount of $72,204 from the North Carolina Department of Health and Human Services Division of Public Health Epidemiology section of the Communicable Disease Branch. These funds are to assist Durham Public Health to help support activities associated with the number of refugee arrivals to Durham County, which also is going to bring our new total screenings to 725 screenings. The last budget ordinance, the board is requested to approve budget ordinance amendment to recognize funds in the amount of $177,560 from the North Carolina Department DHHS Division of Public Health Epidemiology section of the Immunization Branch. And these funds are intended to continue activities that focus on removing barriers to accessing vaccine, increasing vaccine confidence, and coordinating COVID-19 activities, vaccine activity services, and expanding its COVID-19 vaccination program. Those are your 4 budget amendments, Mr. Chair.
Thank you, Dr. Jenkins. So we have heard the budget amendments, and I will entertain a motion to accept them all.
A motion to accept all 4.
Very good.
Second.
All right, it has been moved and properly seconded. If there's no unreadiness, we're ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Miller,
Yes.
Commissioner Alon, Dr. Glover, Dr. O'Toole,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
Dr. LaRon Jackson.
Yes.
Thank you.
All right, thank you. So we'll listen to or entertain any suggestions for agenda items for our next meeting, which will be in October, the second Thursday of October.
Mr. Chair, we look forward to introducing you to the new opioid settlement manager formally. So that's one thing that you can count on.
Very good. Any suggestions for agenda items for that October meeting?
Yes.
Okay, Dr. Jackson, I'm sorry.
I would love to hear an update on the community health improvement plan that will be submitted just in September.
More than happy to get that for you, Dr. LaRon Jackson. And Mr. Chair, I can assure you that between now and October, there will be a couple other things. So I will say first, every other meeting, prepare for a slightly longer one, but we'll do our best to streamline it and make it more succinct.
Absolutely. Thank you. Thank you. All right. Well, before we entertain a motion to adjourn, I wanted to publicly, I've done it a number of times here, but I want to publicly recognize and congratulate our director, Dr. Rod Jenkins, for completion of his PhD in public health at the University of North Carolina at Chapel Hill. So kudos to our fearless leader. And we are appreciative of the extra effort and academic credentialing that you've gone through, and we're excited for you, and want to just publicly congratulate you.
To this excellent board with this excellent chair and all its excellent people, I just say thank you all for the faith that you have in me to run this local health department with the help of many talented people, but to also fulfill one of my lifelong goals and dreams, which is to get my doctorate. It was a pleasure. It was hard when you think back to the fact that I started it in August of 2021. COVID was rampant, and we didn't know where we were coming or going, but I found a little respite in being able to disconnect and learn and do the things that are necessary to have the knowledge to run public health with the latest and greatest. But I appreciate the faith and the support and the encouragement that this board has given me over the years, and I'm eternally grateful.
Thank you. Congratulations. All right. So with that being said, I will entertain a motion to adjourn at this time.
Motion to adjourn.
Do we have a second?
Second.
Very good. If there is no unreadiness, we are ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Miller,
Yes.
Commissioner Alam, Dr. Glover, Dr. Otor,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
Dr. LaRon Jackson.
Yes.
Thank you.
Thank you all. Once again, hope you had a great summer. We'll see you in October.
Take care, everyone.
All right. Thank you.
Dr. Jenkins, I will make an effort to come by tomorrow to sign off on the meeting minutes.
We'll be here.
Hopefully sometime before noon.
We look forward to seeing you.
All right. Very good.